Hello everyone, I'm Selda as Group 1 student of the Verbal Behavior course. We will present the project we have done on ABLES and VB-MAP assessment for you.
Hi, my name is Bradley Frias, and I will be going over our hypothetical client summary. Our client is a 5-year-old female who was diagnosed with autism 3 years ago. The reason for referral is maladaptive behaviors, which present via elopement and biting and physical aggression. She's currently receiving special education, ABA, OT, and speech, and her strengths are daily living skills. Examples of that are independent restroom use and play skills.
I'm Kylie, and I'll be talking about the VB-MAP assessment. So the VB-MAP is an assessment tool and curriculum guide for those with autism or other language delays. It tests up to the verbal milestones of a 4-year-old, but can be used for anyone who has not met those milestones of a typically developing 4-year-old. There's 5 different assessments that kind of go into this one assessment. The first one is the milestones. It scores a child's current verbal skills and related skills, testing 170 different milestones. There's the barriers assessment, which scores 24 common learning and language acquisition barriers to help identify strategies to overcome them. There's the transition assessment, which scores 18 different assessment areas to see if the child is making meaningful progress. Then there's the task analysis and supporting skills, which helps identify and test skills that are directly related to that milestone assessment. And then there's the placement and IEP goals, which provide direction for each of those 170 milestones and suggestions for IEP goals.
My name is Samantha Brocker, and I'll be talking about the ABLES assessment. So this is a skills-based assessment that can be used to identify skills that a child will need to communicate and learn from everyday experiences. It's generally used with children between 2 and 6 years old, but can be used with children up to 8 if there's severe language and communication delays. The assessment assesses 25 different skill areas, ranging in everything from language and social interaction to self-help skills and academics. It's implemented by assessing each of the child's skills in each area, with the difficulty increasing until they either reach the maximum for the skill or are unable to perform the skill at that level. These are then scored so improvements can be tracked across subsequent assessments. These are also used to create learning goals, and they can help guide IEP goals. A couple limitations to the ABLES is it doesn't cover every skill a child could possibly need, and it's rather lengthy to complete. It can take anywhere from 3 to 10 hours. It also does not provide instructions on how to teach children the skills they're lacking.
Hi, my name is Marilyn Braza, and I'm going to be talking about the assessment choice. So we chose the VB-MAP because it is going to be preferred for the client because it does promote a general development-based criteria, and then also focuses on skills that the child needs to improve. And since our client has some verbal but has very minimum language production skills, the VB-MAP is best useful, especially in building the client's existing verbal repertoire and using it to develop further language skills. The reason why ABLES wasn't chosen was because due to it does not assess to sensory behavior concerns and is designed for younger ages and does not include milestones. So for the next steps of VB-MAP testing, we are going to coordinate a date and time in order to administer and implement the VB-MAP in a school setting, consult with the team and analyze and evaluate the scores, finalize a treatment plan, conduct and coordinate a care meeting with all providers, and then we're going to consult and collaborate with the school to develop an evidence-based appropriate intervention, and then also review and update any IEP to ensure that all the goals interventions meet the academic, behavior, and social emotional needs for the client.